and there's a vertical cut and a horizontal cut. The eye is totally filled with blood, and the bone over the eye is broken. Let's take a look day by day at how Silver Sol can help. By the way, Silver Sol gel was applied 4 times a day to the wounds and consumed orally in liquid form twice a day, 2 teaspoons. So again, the treatment, Silver Sol liquid, 2 teaspoons twice a day, and the gel applied 4 times a day. You can see that this is a very nasty impact wound. Let's take a look at the next day. Here we are at day 2. The blood over the eye has pooled under the eye because of gravity, but there is no infection yet. There is little inflammation, and let's take a look at day 3. At day 3, it has already stuck together. What that means is that the irregular edges of the cut have stuck together and closed the wound. What this means is the stitches can come out. Yes, as early as day 3, the stitches were taken out. There's no infection, and healing looks good. Here we are at day 5. You can see this is healed remarkably well when you look over the eye and over the forehead. Those are healing nicely, but look at the bruise. That bruise was so significant it should have taken 2 or 3 weeks to heal, and yet in 5 days, because the gel was placed all over the entire face, the reabsorption of that bruise has been accelerated. And here we have complete healing in as little as 7 days. This should have taken 3 weeks, according to Colonel Al Moloff, MD, who was president of Special Operations Medical, our military's top doctor, who has seen many injuries. He said, quote, "It healed twice as fast or maybe 3 times as fast as any wound like it." So as you can see, Silver Sol helps with wound healing by controlling inflammation, infection, and accelerating the stem cell activity. This quote comes from the Journal of the American Association of Anti-Aging Medicine, and I'm the author. Silver Sol has antimicrobial abilities that help reduce infection and inflammation, resulting in better healing. Since inflammation lasts as long as there is debris or infection in the wound, it can be said that Silver Sol can remove the cause of a significant amount of infection, inflammation, and chronic wounds. This is a photograph from an electron microscope demonstrating that Silver Sol resonates at a specific frequency and is measured to be of a specific nanoparticle size. Beams of ultraviolet light destroy bacteria, and that's been proven in many chemical and medicinal journals. What we found here and measured is that Silver Sol resonates at a frequency that's ultraviolet, or 910 terahertz. Since Silver Sol resonates at 910 terahertz and it's measured to be a nanoparticle, what that means is it can enter your red blood cell, because it's so tiny. It can take a ride in that red blood cell throughout all of your body, wherever circulation goes, and it will resonate at a frequency that's germicidal. Yes, this frequency kills germs, and we found in hospitals and laboratories that have those ultraviolet lights that kill germs, they resonate at exactly the same frequency. On the right, you've got a photograph of a letter. It comes from the former Surgeon General of the Air Force, P.K. Carlton, M.D. So he's an M.D., he's a Surgeon General for the Air Force, and he requests Silver Sol for use against pandemic and infectious diseases in this letter. I'm going to go to the next slide and read quotes from it. Here you have Surgeon General P.K. Carlton, M.D., Director of the Integrative Center for Homeland Security currently, who recommends, quote, "I would like to bring your attention to a resource I feel can be utilized in the area of biodefense, from bioterrorism to infectious diseases such as SARS. The antimicrobial has undergone rigorous testing and has been found to kill anthrax, bubonic plague, hospital staff, and SARS. It is the first new antimicrobial for the hospital in many years. In addition," he goes on, "the product is non-toxic to humans, approved for hospital staff, bubonic plague, and currently awaiting Section 18 approval for anthrax. In short, we currently do not have anything with such a wide spectrum of efficacy in our inventory. As such, I recommend that the antimicrobial be evaluated for addition to the National Pushback Stockpile." What this means is you've got the top doctor in our Homeland Security and a Surgeon General saying we need to have this product stockpiled for every single person in the event there's an epidemic or pandemic. Now, until that day happens, you have the ability to purchase this product, put it in your home, and stockpile it for every one of your family members. Let's talk quickly about safety. The Merck Index reports the following about silver. It is a metal that does not accumulate in the fats and is the only metal that is not considered to be a heavy metal because it does not produce heavy metal poisoning. By the way, that refers to pure metallic silver. Colloidal and ionic silver can be poisonous, but we're pointing out that in fact this is a pure metal in silver sol form. It is non-toxic even at very high amounts. 99% of it leaves the body by the next day, and it is safe and non-toxic. In fact, it would take a spill of over 12 million gallons to be considered a reportable spill, according to the EPA. In the past year, there's numerous scientific studies that have been published on silver sol. In addition to the 200 that have been published or have been studied, you've got the following just in the last year. Successful use in hospital-acquired MRSA, the nastiest infection in America today. You've got silver sol MRSA case studies in the American Academy of Anti-Aging Medicine. Silver sol is beneficial to wound healing, beneficial for HIV patients. It prevents bird flu, diabetic ulcers. You can see that there's many studies on very significant issues. So you can be assured when you take silver sol liquid or gel and use it topically, it's going to work on cuts and scrapes and lacerations and bites and burns. The gel can be used topically as well, but both of them can be used internally, where you're going to disinfect from the inside out, meaning the silver will enter the bloodstream, circulate through the bloodstream, and resonate at a frequency that's germicidal. Your first line of defense, reach for silver sol. Silver sol has many delivery systems. You can use it orally. You can put it in a nebulizer and inhale the mist for use against pneumonia. It can be used topically as a gel or a liquid. It could be mixed into a poultice. There have been studies on IV and gel usage. Cosmetically, it works terrific, especially killing the bacteria causing acne. It can be sprayed on your skin, in your eyes, or other orifices of your body. Intranasal, my gosh, sinus infections are just absolutely without control during certain seasons of the year, but a spray up in the nostrils will deliver the silver into your nasal cavities where it can destroy those pathogens. It can be used intravaginally as a douche with a liquid, or on the tip of a tampon in a gel. Ears, nose, throat, it can be used after colonics, it can be used as a wound dressing and even purifies water. The dose of silver sol is as follows. For prevention, as little as 1 teaspoon 1 to 3 times a day. But most people use 2 teaspoons twice a day, and they'll actually double it when they get sick. Serious or aggressive doses have been used 2 tablespoons 2 to 4 times a day, and some actually really aggressive diseases that we're not going to elaborate on right now have actually taken 4, even 8 ounces at a day. So demonstrating safety for long periods of time, even in serious injuries and serious illnesses, silver can be taken at high amounts. Gel use, apply to your affected area liberally as needed. So in summary, children get half the dose that adults get. You can give it to even 1-month-old children. Again, the rule of 2s is most appropriate. 2 teaspoons twice a day orally and twice a day for the gel. You can use it more in more serious conditions. Silver sol will change your life. It destroys bacteria, viruses, and fungus, giving you a first line of defense. It can purify water. It can be used in every orifice of the body. It does not destroy your good bacteria. And by the way, you'll know that because you don't get diarrhea when you take it. It can be taken every day for prevention. It can be used because it has been proven and published in over 200 scientific studies. It has an approved patent, and it's approved as a drug in India and other countries, and in America. The gel, in its 32 part per million form, has FDA approval to be used even against MRSA and other pathogens. It works inside and outside the body. It helps stimulate stem cells. It is an antibiotic alternative and produces no resistance. As you can see, already, with just these bullet points, silver sol can change your life. What you can expect with silver sol is protection, prevention, wound healing, confidence that you're taking something that's going to destroy bacteria, viruses, and mold. You're going to get maintenance doses that will help you and give you peace of mind, and the proper investment in a healthy future, meaning you'll control when you take it and when you don't. Some people will take it every day for prevention. Some people will take higher doses depending on what their problems are. Some people will leave it in their garage and wait for an epidemic and only take it at those times they really think they need it. All of them are correct. But your first line of defense is Silver Sol. It will make your other supplements function better. How does it do that? It takes the workload off the immune system so that when you give echinacea or ginseng or something that asks your immune system to work harder, it is available to actually do the work, because the bacteria, viruses, and fungus that usually tie up your immune system are no longer present. This is why the supplements that you take with it will actually be able to have a better impact on your immune system, and you will have a better quality of life. In conclusion and summary, Silver Sol is patented, EPA approved, FDA certified, is safe, beneficial, and cost-effective, actually costing half of its competing silvers. It is truly unique and is your first line of defense against the broadest spectrum of pathogens. It is a new vector in healthcare where it is safe enough to use at home, but effective enough to use for the most dangerous infections in the hospital. This is your first line of defense, Silver Sol, a unique form of silver.